Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss continued pain after surgery, 5 years or more after having surgery. So before I jump into this, be sure to hit that subscribe button and turn on the notifications to catch all of our latest videos related to knee replacement surgery, rehab and recovery, exercises, and everything else. So when we're talking about pain that has lasted and is continuing to be experienced and continues to go on 5 years out from having surgery, or this is applicable to someone who's had it more than 5 years out from surgery, or even if you're 2 months out or a year and a half out from surgery and you still have this pain and discomfort, there's really a changeover now. So any of the healing that would occur from having a knee replacement surgery, so any of the healing to the soft tissue, so the muscles, the ligaments, the tendons, the healing of the bone and the joint itself, at this point out after surgery, that healing has essentially all occurred at this point. All the phases of healing have occurred, and everything has happened in that regard. And so we can't really make the reason for your continued pain to be something due to the healing after surgery or the sequelae of having a knee replacement surgery. Now, we do have to look at any possible red flags, so possibly infection, a fracture, loosening of the prosthetic, or just a poor fit of the prosthetic. But if those are ruled out and those things have been ruled out, then what we're looking at really more is persistent pain, or something that may be labeled as chronic pain. And this is that pain that lasts for a chronic amount of time. So more than, I don't know what the formal definition is, but it's lasted for months to years or even more than that. And the reason for this, and the reason for chronic pain, is multifactorial. And what I mean by that is there are so many different things that are contributing to that pain response. When you normally have pain, it is often in relation to an injury, or you're recovering from surgery, or something of that manner. And the correlation between what's going on in your body and the injury or the damage to the tissues, or the inflammation or the flare-up, and the amount of pain that you're experiencing, that correlates pretty well in the short term, and then your body heals and recovers, and usually that pain subsides. With chronic pain and persistent pain, and that's what we're considering this to be, the correlation between what's actually going on in your body in terms of injury or damage to the tissues or the bone or the muscles, and the amount of pain that you're experiencing, this correlation is poor. It's incorrect. It's kind of broken, so to speak. And this isn't necessarily an issue with your body and its structures. It's more an issue of the central nervous system and the brain and the peripheral nervous system and your nerves, and the pain signals that your body is receiving and interpreting. And so what I mean by this is essentially your body has gotten too good at experiencing pain, and it is hypersensitive, so to speak. So the nerves and everything else, things that for someone else that normally wouldn't cause any pain or discomfort, for you are causing this pain and causing this discomfort and possibly other symptoms in and around your knee joint. And so the best thing that we can possibly do about this is, thankfully, that we can retrain your brain, we can retrain your nerves and your central nervous system and your peripheral nervous system to experience pain in a more normal pattern, where that correlation between actual harm and actual injury is correlated well with the pain response. So if nothing is going on or there's no harm, then the pain response is nothing or minimal. And if there is significant harm, well, then you appropriately would have a good pain response. So all that being said, we have to retrain the nervous system. And the way we can do this is by movement. Movement is medicine. Now, you say, well, it's painful if I move. It's painful if I do different activities and different things. But what I want to challenge you to think and to internalize is that the pain does not necessarily mean damage. The pain does not mean harm. It doesn't mean injury. That pain signal that you're getting is misinformation. It's incorrect. And we're trying to retrain that system. So it's okay and it's appropriate to work through that pain with whatever the activity is or the thing that you're doing. Now with this is within reason. We don't want to do so much activity in something that's so painful and so uncomfortable that it's going to cause this acute flare-up of symptoms, and you're just going to really feel crummy and have this pain and stiffness, and it's going to set you back for the next few days or even a week or so. We want to find kind of that happy medium where we can say, okay, I'm experiencing this pain and discomfort. It's mild or maybe moderate, but I'm going to try to work through it a little bit. And what I encourage people to do with my patients and clients is I ask them, if you didn't have this pain or this symptoms with your knee, what activities or what things would you be doing or would you want to do? And there's all sorts of answers out there, such as I'd be going for walks regularly. I would be maybe golfing. I would be hiking. I would be cycling or biking. I would be gardening. Whatever that thing is for you. And my encouragement in order to get the body moving, in order to retrain those nerves, retrain the body and the brain, is to start to do that activity. Start to do it though at a milder fashion, start to do it at a lower frequency, a lower intensity. So it's going to obviously vary depending on what it is. But maybe you just want to get back to going for walks with your significant other. So you want to eventually be able to go for a 30-minute walk after dinner or before dinner. And so you're not going to start with a 30-minute walk. Maybe you start with a 5-minute walk. And you do it on a level surface, and you do it with maybe a gravel or a dirt surface. It's not as much pressure through the legs and through the knees. And then hopefully that goes okay. And then the next day or in a few days, maybe you work up to 6 or 7 minutes of walking. Or maybe you add a little bit of an incline to the walk. Or you do a different surface that you walk on. Or you increase your speed a little bit. But the idea is that you're starting with something that's very low intensity, very low frequency and volume and impact. And you're going to progressively increase that over time. Like I said again, we are okay, and it is okay to work through that pain and work through that discomfort. Remember, that pain signal is inaccurate right now. It's telling you pain, 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 but you know that this activity is not harmful. It's not going to cause injury. It's not going to cause damage. And it's okay to work through that pain to an extent. If it gets too intense, that pain, and you feel like you're just going to have a flare-up, then take a break and ease off of it and try again another day. But the idea is that movement is going to be your medicine. It's going to retrain your nerves, it's going to retrain your brain, and slowly, 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 lots of patience, lots of consistency, that's how you're going to start to retrain the brain, retrain the nerves. You're going to decrease some of that sensitivity, and hopefully over time decrease some of that pain, discomfort, and other symptoms. So the key take-home message is pain is complex. Pain has multiple factors that play a part with it. Your knee and the tissues and everything can look perfect and could look like a normal, healthy knee after a knee replacement surgery. But you can still be experiencing that pain. It's no longer an issue with the tissues or injury or damage to the knee. Now it's an issue of retraining the nervous system, getting it moving, and progressively increasing your activity, increasing your tolerance, and hopefully addressing and managing this persistent and chronic pain in an effective manner. I'd love to hear your questions. I'd love to hear your comments below, so be sure to leave them. I know there's plenty of people out there who unfortunately there's a percentage of folks who don't have a great outcome after surgery, and they continue to have pain and continue to have symptoms, and I want to be helpful and help you to manage this and deal with it effectively. Not always, almost very little or not as often. The answer is not more surgeries, more x-rays, more MRIs, more medicine, more this and that. Sometimes it's as simple as trying to progressively just get the body moving, get the knee moving, and retraining your brain, retraining your body to improve tolerance and decrease symptoms. I hope you found this very helpful. I appreciate it. Please be sure to hit that subscribe button if you're interested in many more videos similar to this, and thank you very much for watching.